It's no wonder that skin cancer is the most common of all cancers in our country. As the days get longer and the temperatures get hotter, millions of Americans throw caution to the wind and expose their skin to the sun's harmful rays. For what's perceived as a healthy glow, it can be even more dangerous than you might think. Joining me today from Midstate Medical Center are Dr. Susan Alsamarai and Katherine, who's a registered nurse there. Ladies, thanks for being here.
Thanks for having us.
Doctor, let's go through some statistics about skin cancer because it's frightening.
Yes, and so this is a great time to talk about it too with the summer coming up. So I think what's important to know is that skin cancer is it's actually the most rapidly rising preventable cancer. So it's okay to enjoy the sun, but know how to prevent it and what risk factors there are that we can avoid.
Sure.
So when we talk about skin cancer, there are three main kinds that we think about. So the most common, so there are about 3.5 million cases a year of skin cancer, which is a pretty whopping number. So the most common is called basal cell cancer, and that's from the cell it originates from, which are kind of deep in the skin. And they can look pearly in appearance, and these are very treatable. They can be cut out, have a low chance of spreading.
Okay.
They make up about 80% of all cancers of the skin. The second most common is from kind of the superficial layer of the skin that sloughs off. It's called squamous cell. And they're about less than 20%, and they're also very treatable, rarely spread. But the kind we will focus on that we're most concerned about are melanomas, which come from the pigment cells, the melanocytes. And the problem with these is that although they're a very small percent of skin cancers, about 2% of this 3.5 million,
Sure.
They're the most deadly. So there are about 76,000 new cases of melanoma per year and about 10,000 deaths per year for melanoma.
And are there warning signs, something to look for?
Yep, so exactly. So there are certainly risk factors and warning signs, which we'll go through. So some risk factors, the main one is UV light. So we think of that in terms of the sun, and both being out in the sun on the beach, but also things like driving, so windows, sunroofs are ways that you're exposed to think about. Also tanning beds, especially among younger populations. So this is a population under 30 age where the rate is very much rising. Other things to think about are also just our characteristics. So some personal characteristics put you a little more at risk. So very fair skin, the kind of skin that burns instead of tans is a risk factor. Light hair, so blonde, red hair, green eyes, blue eyes, a high density of freckles are things also that can put you at risk.
Very good.
And also burning, so about 5 mild sunburns or 1 blistering sunburn doubles your risk of skin cancer. So these are things to avoid.
All right, now we have some pictures here, and it kind of goes along with the acronym A, B, C, D, E.
Yes,
So
exactly.
we'll put the pictures up, and you could explain, Doctor, what we're looking
So
at.
these are things, some things to look for in terms of melanoma, and it should be easy to remember. So A is for asymmetry. So this would be a normal lesion. And the next one. So you can see that here it's asymmetric. So one half of the mole looks a bit different than the other half.
Okay.
So B is for borders. And here we have one. To see how the borders are very nice and crisp, this is what would be called a benign lesion.
Okay.
And we'll contrast this to the next one.
Oh, certainly no borders there.
Exactly. So you're seeing very rough, ragged borders. They're irregular. The color can kind of spill out from beyond the borders, and that's concerning. C is for color. And this, you see the color is sort of uniform throughout. And this is, again, a benign lesion. Contrast that to here, and you can see the color here is not symmetric or not uniform throughout the lesion, and there are areas that maybe are more red, darker, can be gray in coloration. And the next one, D, is for diameter, and that's the size. So this is a normal size lesion, and the higher risk are when you're talking about something greater than 6 millimeters, or which is about the size of a pencil eraser. So that's a warning sign as well.
Okay.
And the E is for evolution or evolving. And what this means is that if you notice something that's changing, so whether this is a lesion on your skin that's getting larger, or if it has new sensations, such as becomes very itchy or painful, or starts to bleed or ooze, these are things that
should keep an eye on it, right?
Exactly, should prompt attention.
And we know that May is Skin Cancer Awareness Month.
Yes.
And Katherine, I want to bring you into the conversation. Is there a safe way to tan?
There really is no safe way to tan.
Okay.
Spray-on tans, don't do it. and we don't really know about a lot of chemicals that are used now. And tanning beds, as Dr. Alsamarai said, are really dangerous, especially with young people.
So let's talk a little bit about the props that you brought with you today.
So we brought a few props. One is a hat. Hat's really essential. You should.
But this is a special hat.
This is
pretty
a
cool.
special hat. Well, about hats, any hat that you get, the brim should be at least 3 inches because that's going to protect your face and the back of your neck. And a lot of people wear ball caps, and ball caps are fine, but you need to make sure that you have sunblock on the back of your neck if you're wearing a ball cap, plus the top of your ears, because that's an area that gets burnt pretty easily. This hat actually has a built-in sun protection factor right into the fabric
terrific.
itself.
Okay.
So these, you can find them online, but they're much safer than other hats. And actually, they make fabrics too with a built-in sun protection fabric. This is a cover up, and if you want to feel it, you can tell it feels just like a regular fabric.
But there's a sun protection
There's sun
in there.
protection in there, and it doesn't wash out. So it's there
great.
from the first day to the last day when you have the garment.
All right, we have about a minute left. I want to talk quickly about sunblock and SPF. You told me those bigger numbers, 80 plus, they might not do as much as good as people might think.
No, sun protection factors between 15 and 30 really are the optimal. If you're very fair-skinned or you're in a group, if you freckle a lot, here I am, you might want to go up to 50 if you have very fair skin. But really, those 80s and 100s are very expensive, much more expensive in proportion to what you're getting. It also gives people a false sense of security that they're totally protected from the sun.
All right, and you should use about a shot glass full
Use about a
for
shot glass
adults.
full.
And you have some seminars also free to the public to help people out. So let's put that information up on the screen there. Tuesday, May 6th, Monday, May 19th, Thursday, May 22nd. The times are right there on your screen. You can call 203-694-8631 to reserve your spot. Dr. Katherine, thanks so much for being here and for all the information. We'll take a look here at Midstate Medical. If you want more information, they're located at 435 Lewis Avenue in Meriden. You can call 1-800-DOCTORS or visit midstatemedical.org.